Healthcare closures are personal for people in Perth, Ontario. Their local emergency room shut down for 3 weeks this summer because there wasn't enough staff to keep it open.
I was actually personally devastated by that closure because I still think we had let the community down and left them vulnerable.
The closest ER nearly 25 kilometers away. The doors to this department have since reopened, but this doctor says the situation is still dire.
Patients lying in our stretchers are in our hallways, admitted, but no bed for them to go to.
Now, an urgent warning from the Ontario Health Coalition. The situation is only getting worse.
We have broken the all-time record for emergency department closures.
The coalition says there have been 868 ER closures so far this year because of staffing shortages. It's a problem across Canada. Earlier this year in Newfoundland, a man suffering from an asthma attack found his local ER temporarily shut down. He later died in an ambulance heading to another hospital. The emergency room in rural Minden, Ontario, closed permanently in June.
So the blue H used to be in the left corner.
This man is fighting for it to reopen for people like his 6-year-old daughter who needed urgent care earlier this year.
She said, "Daddy, it's my heart." Right away, I ran down. She was at 240 beats a minute. Instead of calling EMS, I was able to get her into the truck as we were only 1 block away from the Minden Emergency Department.
We need leadership. We need the Ford government to take responsibility for the planning of our health system.
Ontario's health minister says the government is working to improve the system.
In last year's budget alone, we had an average increase in our hospital budgets of 4%. Those are the changes that we make as a government.
And Nicole, the Ontario Health Coalition says the problems go way beyond emergency rooms.
That's right. They've listed hundreds of other closures since the beginning of the year. 300 urgent care centers, a labor and delivery unit, even an ICU had to close. The list goes on, and their message is clear. These services are essential, and these closures are putting people at risk.
All right, Nicole Williams in Ottawa. Thank you.